Did you know that on average, 1,000 Filipinos die every week from drug overdose? Roughly 7.1 million individuals in the Philippines are dependent or abuse illicit drugs, but only 15% of them are receiving treatment. There's an overwhelming amount of prejudice and misinformation around drug addiction and substance use disorders, making it difficult to seek treatment. Yes, this number include opioid abuse, but that's not the only substance leading to these drastic numbers of death. Death are also influenced by other things, like alcohol, other illicit drugs, and even tobacco. Addiction is a chronic disease characterized by drug seeking and use that is compulsive or difficult to control, despite harmful consequences. The initial decision to take drug is voluntary for most people, but repeated drug use can lead to brain changes that challenge an addicted person's self-control and interfere with their ability to resist intense urge to take drugs. These brain changes can be persistent, which is why drug addiction is considered a relapsing disease. People in recovery from drug use disorders are increased risk for returning to drug use even after years of not taking the drug. Addictions are not the problem of willpower or morality. Addiction is a powerful and complex disease. People who have an addiction to drugs cannot simply quit, even if they want to. The drugs change the brain in a way that makes us quitting physically and mentally difficult. Treating addiction often requires lifelong care and therapy. Drug addiction can be influenced by many factors, ranging from things like medical prescriptions to economic status to social norms to parents or friends' influence and so much more.
Drugs are chemicals that affect the body and brain.
Drug is not a friend. It's actually an enemy. Before tasting it, think about first.
Ngayong nauuso ang mga e-cigarette, nauuso rin daw ang pagpupuslit ng liquid form ng marijuana na ginagamit sa pagve-vape. Kinukubli ang vial ng marijuana oil sa pakete ng e-cigarette. Ganito ang 18 piraso ng nakumpiskang e-cigarette sa NAIA na ipinadala ng isang John John Pulido mula sa Carson, California. 300,000 piso ang kabuuang halaga ng nakumpiskang kontrabando. Nakatanggap ng tip ang Pilipinas mula sa US Drug Enforcement Agency tungkol sa ganitong paraan ng pagpapalusot ng iligal na droga.
When we see those kinds of declarations, automatically it goes through a very tedious screening process.
Naaresto si Bo Aldrich Sikian, 24 years old, nang sunduin ang 2 pakete sa airport. Isa sa mga pakete nakapangalan sa isang taga Baguio City. Tumangging magbigay ng pahayag si Sikian. Tingin ni Customs Commissioner Isidro La Peña, bahagi ito ng Mexico-Sinaloa cartel.
Ganito lang yung quantity, but there could be more shipment through other ways. Aside from through the airport, it could be they are doing it also through the seaports. That's why we are on the watch.
May mga kaya raw ang customer ng ganitong pakete ng vape na tig 20,000 piso sa underground market.
Anywhere they can use it kasi hindi naman siya sigarilyo. We have reports na natatanggap sa isang shopping center na talagang prevalent ang pagbebenta niyan.
Ito ang unang pagkakataon na nakakumpiska ng vape at marijuana oil ang PIDEA at Customs. Babala na rin daw ito na nabuko na ang ganitong paraan, kaya di malayong muling magkahulihan. Maki Pulido, GMA News.
Cocaine is a highly addictive drug that ups your level of alertness, attention, and energy. You may hear it called a stimulant. It's made from the coca plant, which is native to South America. It's illegal in the US. Other names for it include coke, snow, rock, blow, crack. It comes in a few different forms. The most common is white powder. It can also be made into a solid rock crystal. Most cocaine users snort the white powder into their lungs. Some rub it onto their gums or dissolve it in water and inject it with a needle. Others heat up the rock crystal and breathe their smoke into the lungs. The drug sends high levels of dopamine, a natural chemical messenger in your body, into the part of your brain that controls pleasure. This builds up causes intense feelings of energy and alertness called as
Commonly used drugs. The commonly used drugs is marijuana. What is marijuana? Marijuana is the third most popular recreational drugs in America and the number one most abused illicit drug. The dried parts of the cannabis plant can cause distorted perception, impaired coordinations, and problems with learning and memory. Tetrahydrocannabinol or THC is the active ingredient in marijuana responsible for its high feelings. We all know how marijuana has been a big issue and topic until now around the world. Others want it to be legal and others don't want to. Different opinions and perceptions. Marijuana is the most abused illegal drugs, especially in America. Even though people are enjoying this, part of it has a dangerous effect. That's why it can cause many problems among people.
What is alcoholic drink? Alcoholic drink is a drink that contains ethanol, a type of alcohol that produced by the fermentation of grains, fruits, or other source of sugar that contains as a drug. The consumption of alcohol plays an important social role in many cultures. In the Philippines, drinking alcohol is normal and famous, but Philippines create a law to set the minimal drinking age at 18, but underage drinking is widespread. Even when there's no occasion, many Filipino hang out together in the street, in the front of their houses and convenience store, drinking gin and tonic, which is considerably cheaper alcohol drink. Now, I have the two types of alcohol here. The first one is the hard alcohol and the second one is the alcoholic beer. These two kinds of drinking alcohol is very famous here in the Philippines. And kung saan ka pupuntang okasyon or gatherings, makikita mo ang dalawang klase ng alak na ito. Drinking too much alcohol can harm your health. Now, these are the possible diseases or the serious problem that you can get if you are too much drinking alcohol, including high blood pressure, heart diseases, stroke, liver diseases, and digestive problems. In cancer, you can get the mouth, breast, throat, esophagus, voice box, liver, colon, and rectum cancer. Para maiwasan mga ito, kailangan mo magkaroon ng disiplina sa pag-inom ng alak at hindi dapat ito inaabuso at hindi dapat ito araw-arawin upang maiwasan ang mga sakit na aking nabanggit. Kaya, kung iinom ka man ng alak, make sure that you are responsible na gawin ito at responsible ka sa iyong mga actions na gagawin.
3 things that can contribute to addiction. The first one is poverty. Substance misuse is frequently assumed to be more widespread among financially deprived people, while in the other hand, a lack of money does not directly cause drug or alcohol abuse. Poverty and addiction have a complex relationship. Poverty and substance misuse are linked in both directions. Poverty causes people to consume drugs, and those who battle with addiction are more likely to become impoverished. This link creates a vicious cycle that can damage families for generations. The second one is trauma. Addiction is a high-risk factor for those who have experienced trauma. In one research of women who seeking substance misuse therapy, it was shown that more than 80% of the participants had been previously subjected to physical or sexual assault. Then what's responsible for the link between trauma and addiction? Trauma's psychological repercussions can be severe and long-lasting, as substance misuse is frequently used as a kind of self-medication to assist trauma survivors to cope up with the stress and painful feelings associated with their past events. And the last one is peer pressure. Peer pressure is commonly associated with teen substance misuse, but it can also be a factor in adult substance usage. Individuals are frequently pressured by the people they live with in cases of adult peer pressure. For example, if one spouse drinks heavily or uses drugs, the other spouse may end up joining them. The formerly sober spouse may also use a way to keep the peace and avoid fighting about their loved one's substance use. These actions may seem harmless at first, but they can quickly develop into a full-blown addiction. When someone develops a substance use disorder, there are frequently several elements at play, and no two cases of addiction are comparable. Keep in mind that having the risk factors that contribute to addiction does not ensure that the person will have a problem. A person may have multiple of these risk factors and never develop addiction because they take steps to mitigate the greater risks of developing addiction.
Why do some people become addicted to drugs? No one factor can predict if a person will become addicted to drugs. A combination of factors influences risks for addiction. The more risk factors a person has, the greater the chance that taking drugs can lead to addiction. For example, environment. A person's environment includes many different influences from family and friends to economic status and general quality of life. Factors such as peer pressure, physical and sexual abuse, early exposure to drugs, stress, and parental guidance can greatly affect person's likelihood of drug use and addiction. And genetic and environmental factors interact with critical developmental stages in person's life to affect addiction risk. Although taking drugs at any age can lead to addiction, the earlier that drug use begins, the more likely it will progress to addiction. This is particularly problematic for teens because areas in their brains that control decision-making, judgment, and self-control are still developing. Teens may be especially prone to risky behaviors including trying drugs.
Dapat pala naghanap ako ng ibang paraan. Dapat pala hindi ako nagpadala. Dapat pala pinag-isipan ko muna. Nang dahil sa aking mga nagawa, hindi ko na muling makikita ang aking mga mahal sa buhay. sapagkat kailangan ko itong pagbayaran sa loob ng 20 taon. Sapagkat nalabag ko ang isa sa mga batas kontra droga. Kailangan ko ng pagbayaran ito sapagkat nagpadala ko dito. Kailanman hindi naging maganda ang droga sa ating katawan at sa ating sarili. Kaya't dapat na natin itong tigilan at iwasan.
What's up guys? This is Rex Eugene Carmona Gonzalez from BizEd 1D, your future teacher. So first, I want to ask a question. For your learnings from the past guys, what are the consequences of drug addiction in human life? Anyone? Oh, that's right. Thank you. So, consequences of drug addiction. For me, the consequences of drug addiction affects physical, mental, social, and spiritual health, often severely. First, we have physical consequences. The physical consequences of addiction are perhaps the most obvious to the individual, like increased tolerance, physical dependence, and withdrawal symptoms are all physical consequences. Physical and sexual abuse can also be consequences of addiction. Second, we have mental consequences. Some of the common mental consequences are depression, anxiety, and mood swings. When a person suffers from addiction and also has mental health disorder, whether it began before or after substance use, this is called dual diagnosis. For the exact information of dual diagnosis, this dual diagnosis treatment is the most effective cases. So, the third one is social consequences. The social consequences of addiction are usually the common talk about: dropping out school, job loss, hospitalization, and troubled relationships. Sometimes, a person who is addiction or who is addicted to drug does not seem to face any of these problems. They may hold down a job, get a degree, and maintain relationship. This makes it harder to detect addiction and fosters denial. But addiction is a progressive disease, and eventually, even someone in a function addiction with experienced social problem, they do not get help from addiction. Lastly, we have spiritual consequences. The spiritual consequences of addiction happen to anyone, whether they are religious. These types of consequences includes hopeless, lonely, scared, guilty, ashamed, dishonest, unhappy, and restless for no apparent reasons. As with the mental consequences, spiritual disconnection can become more apparent after drug use has stopped. For me, the consequences of drug abuse may look different for everyone. What may seem mild and insignificant to one person may feel like the end of the world to another. Regardless of individual differences, everyone can recover from addiction with treatment, ongoing support, and a sense of purpose. That's all. Thank you.